This is going to be topic 29, Immunology.
And key concepts. Upon completion of this chapter, you'll understand the interconnectedness of the immune system with all the bodily systems, how overstimulation or responsiveness of the immune system leads to allergy, anaphylaxis, or organ transplant rejection, why immune deficiencies leave the body unprotected, and how the body can develop antibodies against itself. Normal immune system function. We have natural physical barriers, which are the first line of defense, the things like the skin, the secretions that are on top of the skin, and our mucous membranes. Some organisms can invade our defenses, like they present with antigens, and anything that would be considered as a foreign invader to the body is going to be an antigen. Particles of organisms that stimulate the immune response is what an antigen is. And they essentially stimulate mast cells, which we'll look at one here in a second, or the degranulation of a mast cell. And then they spit out a bunch, our immune system spits out a bunch of things called cytokines, which are immune chemicals. This all causes a dysfunction of the immune system, and it limits the body's ability to fight off disease. And we're going to look at three figures here. Figure 29.1, which is the sources of allergens and the modes of entry into the body. Figure 29.2, which is antigens in general and what they are, antigen-antibody reactions. And then figure 29.3, mast cell releasing histamine. First one here we're going to look at. This is allergic reactions. So we can get them from multiple locations, things like skin contact, injection, ingestion, or inhalation. Now, skin contact, very simply, if we get a hold of poison ivy, poison oak, poisonous plants, animal scratches can give us contact dermatitis or inflammation of our skin, pollen, latex. As far as injection, bee stings or any other kind of animal that would inject poison into us could generate anaphylaxis or an allergic reaction. Ingestion, things like medications, nuts, and shellfish. As far as inhalation goes, pollen, dust, mold, or mildew that we come into contact with, animal dander. This is 29.2, an antigen-antibody reaction, and essentially what we have here is our body has produced an antibody that will excite the immune system, and anything that will interact with this antibody would be an antigen-antibody reaction, and that's what it is circled. And once we have this, it essentially kicks off the immune system's response. So this is a mast cell, and once the antigen-antibody reaction reaches the mast cell, its job in life is to release histamine. So it degranulates all these granules through exocytosis, releases cellular material in the cellular environment, and the histamine causes vasodilation. So vasodilation would be this. All of a sudden we have a vessel that's this size, and now it is this size. That causes hypotension, low cardiac output. It pretty much brings about shock unless the body can respond to it. So most of our medications that we talk about later in treatment stop the histamine release and return this back to this. Chief concerns: immune system, interconnected with the body, difficult to recognize its role in the chief concern, and the reason being is because some of the symptoms initially can be like abdominal pain might be one of them, or upset stomach. We are not really thinking that they're having an allergic reaction whenever we get symptoms like this. Consider the conditions in almost any complaint. As far as allergic reaction goes, they are a result of an inappropriate or excessive response of the immune system. Anaphylactic reactions, patients may have previously been sensitized. So if you've been exposed to it before in the past, you've been sensitized to it, you've made antibodies, so you're primed for an antigen-antibody reaction. And subsequent exposures to that same antigen will trigger a more severe response. Angioedema, localized swelling of the lips, tongue, or upper airway in response to specific antigenic stimuli or antigen stimuli. Chief concerns continue. Additional diseases and conditions, things like autoimmune diseases, can also bring about immune responses, or are a product of the immune system, so to speak. They include lupus, they include rheumatoid arthritis. The systemic lupus erythematosus, or lupus, is predominantly affect women from the age 15 to 40, and there's lots of factors that involve the diagnosis of this. Genetic and environmental factors, including UV light exposure, have been implicated with a possible potential cause. Most common manifestation of lupus is going to be joint pain and swelling. Rheumatoid arthritis is the next one on our list. Rheumatoid arthritis is essentially your immune system attacking your joints, a painful deterioration of the joints. Usually targets the synovial joints, or the ones with fluid in them. And we can also have transplant reactions, which is the last one on our list. And there's 3 types. Transplant reactions would be very simply, we put a foreign organ into the system and something didn't match. So out of that, we get a hyperacute phase, which occurs at the time of the transplant. Usually results from a mismatch of the tissue type. We have an acute phase, occurs as early as 1 week after the transplant, but can also occur months to years after the transplant. The immune system essentially attacks the transplanted organ and causes symptoms related to failure of that organ. So the inflammation and the immune system attacking it pretty much puts that organ into failure. And then we have chronic. Chronic can occur from repeated exposures to an acute rejection, or due to a low level in immune attack on the system. The organ becomes permanently damaged and eventually is unable to function. Let's clear this off. So this is characteristic malar rash of systemic lupus erythematosus. And it says, note how the nasolabial folds are spared. And that would be these here, where you normally make wrinkle lines by smiling or with your mouth. The nasolabial folds. They have a reddened look about their nose and cheeks. That's kind of characteristic. Immunodeficiencies. Lack of immune response to stimulating antigens, and has several potential causes on this, which are things like HIV and AIDS, and then medications can immunosuppress an individual as well. Immunosuppression, side effects of certain medications, definition on that. An example of this would be chemotherapy agents used in many cancer patients can diminish the patient's immune response. That's because you get a cellular death systemically with chemo. Chemo is designed to kill cells. Well, it kills some of your good cells along with the bad cells. History and consideration, time course of the current symptoms or the onset and duration, usual progression of the disease. If a person has had allergies in the past and has had the same allergy, they ought to be a good historian of this. What actually triggers the onset of symptoms, and the usual associated symptoms that occur with this. So an example of this, I accidentally ate some shellfish. The last time it occurred, it swelled my tongue up and they had to put in a surgical airway. That would be something that you need to know prior to providing transport for this individual, so that you can kind of plan ahead. Old records or any kind of family members that might be a good historian, how it presented versus past symptoms today. So compare these symptoms with the ones that have occurred in the past. Symptoms of any kind of complications that occur with this, things like fever, cough, chills, rash, dysuria, shortness of breath, chest pain, or headache. Past medical history, we should use the ample mnemonic. Careful attention to the allergies, and that's the ones that would give us hives or urticaria, angioedema, or anaphylaxis. If they're on any kind of medication, full list if possible. Any kind of new medications more specifically. Antibiotics and ACE inhibitors should also be on that list. New onset antibiotics that you have an allergy to could develop after a couple of days of taking it. The ACE inhibitors are notorious for giving patients angioedema or swelling up their tongue. Medication conditions, if they have any new conditions, if they have any existing conditions, or any kind of previous history in this area. And then obtain a vaccination history. Social and family history. Autoimmune diseases might be important as well. Most, however, do not run in families. Genetic predisposition from a family history may give you some clues. Social history, important in establishing disease transmission, and this would be in the cases of IV drug use or HIV risk. On examination, perform a physical exam. Stick with the ABCs. Try to correct them. Check their airway, breathing, and circulation. Reassess during the transport frequently so that you can watch for trending. Signs of any kind of allergic reaction that might pose symptoms while in transit. If you have clinical indication for it, then readjust your diagnosis. Patients not suffering with an allergic response, emphasize the emphasis on those patients shift. Skin temperature and rashes and track marks should be what you should look for. Do they have a fever? Are they having any kind of rashes systemically? Could this be some kind of childhood disease, or could this be things like the mumps or something like that maybe their immunization didn't prepare them for? On assessment, know the immune system conditions, issues with those conditions, indication of any kind of allergic exposure like urticaria or allergic reaction signs. If they have any history of immunosuppression, please get that down and take that into consideration. And if they have a possible risk for infection due to a recent illness or due to medications that they might be on. Treatment, very simply, initial treatment is going to be dealing with their airway, breathing, and circulation. As far as drug choices in the pre-hospital setting, we use things like antihistamine or Benadryl to stop the histamine release. Steroids would suppress the immune system. Salumedrol is one of choice, 125 milligrams IV push for an adult, 2 milligrams per kilogram for a kid. National Registry versus IMSA on this. I'll talk about both here. National Registry, epinephrine of 0.3 milligrams subcutaneous infusion should be used, or subcutaneous sub-Q delivery. And then at IMSA, we get a little bit more aggressive with that. If we're having moderate symptoms or containment is lost, they're starting to become hypotensive, or have a severity of symptoms that would increase our preponderance of evidence that they are having an allergic reaction, then 0.5 milligrams, and we give it IM because it's a faster delivery. Consider perennial pain medications as well whenever we're looking at this. So if they're in pain, they're in joint pain or whatever, we're not the pain medicine police. Be sure that they don't have anything as far as pain medicines on board already, or if they do I take the risk of giving them too much pain medication? So keep that in consideration as well whenever you're looking at that. On evaluation, medical conditions are dynamic. Status may change during transport, so assess frequently. Maintain constant vigilance to assess for any changes that might occur. Hypotension and intravenous fluid administration. It is very important to monitor the patient's respiratory status and airway and ventilation. On disposition, immune-related concerns like lupus or anything like that can be transported to the emergency room for further evaluation. Disposition on unstable patients, they should be transported to the closest facility. Any kind of disorders of the immune system present a significant challenge to the paramedic for diagnosis. In conclusion, the immune system provides the body with a comprehensive defense against attacking organisms. Although the defense system is essential, in some cases the body can hurt itself and overreact to an external stimulus or attack a transplanted organ or tissue. With an excellent understanding of the immune system, the paramedic will be able to effectively treat patients with immune system disorders.
If you have any questions concerning this topic, my name is Roy Smith, SmithArt Samaritan EMS OK.com, or 405-492-8243. Thank you.